How do you get your clients to stop no-showing and actually keep their therapy appointments? That's today's question for Ask Jennifer. Hi there, Jennifer Sneeden here, LMFT and founder of Thriving Therapy Practice. Today's question comes to us from Joy Acaso, and Joy wants to know, how do I keep my clients from no-showing and canceling for their appointments? So Joy, listen, I feel your pain. This is a really difficult, it's really frustrating. You work so hard to schedule an appointment and then the client doesn't come. So let me break this into a couple of different categories for you, okay? The first is if they're not showing up for their first appointment. If they're not showing up for their first appointment, then there's a breakdown somewhere in the marketing process that gets them there. Either they're just really not quite ready for therapy and they called because you're on their insurance panel or something like that, but they're not quite ready. The way you stop this from happening is with a really good screening process and with a welcome kit. You send them information prior to the appointment. You are engaging with them before they even come. Now, if you've got a large wait list and somebody's appointment is 2 to 3 weeks away, you do have a higher no-show rate. The next place to look at no-shows is if they're not coming back after the first or second session. If this is happening, quite frankly, it might be a clinical issue. It might be that you're not connecting with them at the level that they need. You're just not the right therapist for them, and that's okay. There's another therapist that is better for them, and there are clients out there that are waiting for you. So whether you're the right therapist for them or not, you won't know that until you're a session or two in, and that's okay. When somebody no-shows after a session or two, you do want to follow up by phone and just very gently check in and see what they're doing, but it could be that this is not the right fit, and that's totally okay. The next place that we start to see no-shows and cancellations is when you're past that initial crisis phase in treatment. So when I worked with anxiety clients, this was like 2 to 3 sessions in. When I worked with couples, this was like 6 sessions in. The couple isn't fighting anymore. There's peace in their home. Now, as therapists, we know they're not done. We know that we're just beginning to do the work, but they're so happy that they're past that crisis phase that they're not sure they're really ready to go farther with that. Now, this, again, is a clinical issue. The way I think you need to handle this is you need to address it with them up front. So I would always say to my clients, there's going to be a time, probably around 6 sessions in, that you're going to think you're done, but I know that we're just beginning, and often that's where the work starts to get real and starts to get deep. So you're going to want to cancel, and I'm going to remind you of this conversation. See, so right in the beginning of therapy, I'm setting the tone for that so that it didn't come as a surprise to people when they found it. So look at where these no-shows are happening, and if you're getting a cluster of them, they're not showing up for the first appointment, that's really how are you booking the appointments, how are you assessing for fit, how are you connecting with clients before the appointment. If it's after the first session or two, you just might not be the right fit for them and they don't know how to tell you that, and that's totally okay. If it's a little bit into treatment, then likely it's more on the clinical side that you're coming up against something that is difficult for them, and the reality could be that they're not ready to go farther right now, and that's okay. Be very respectful of that, but know that you've come up to a major transition in treatment and things change from that. So look at your numbers and see where this is happening, because depending on where it happens, you need to address it differently. Thank you so much, Joy, for your question. Anybody else has a question, you can send it to me through the link that I've provided, and I will be sure to include it for an upcoming episode of Ask Jennifer.